Good evening, Madam Speaker.
Good evening, sir.
I agree if possible, 150% with our good Representative Conroy. This is an epidemic facing our state, town after town, municipality after municipality. And we need to do something. The time to do something right is not down the line, but it is right now. And that is what this bill amended seeks to do. Yes, it could be seen as an inconvenience for this, that, and the other. But if you look at the overall picture, what this bill achieves, what this bill accomplishes is far more important, far more critical for our state, for our constituents, for our patients, than what might be a little more time that needs to be spent in going through the process. So through you, Madam Speaker, as I said earlier, I'm a strong supporter because I'm very concerned about the epidemic that we have. And this bill definitely leads us in the right direction. Through you, Madam Speaker, a few questions to the good chairman on the bill as amended.
Please frame your questions, sir.
Through you, Madam Speaker, we briefly mentioned in the amendment that if a prescription is for more than a 72-hour period, then obviously the prescriber will have to go and look at the P&P program before prescribing. Through you, Madam Speaker, there are situations, as Representative Conroy said, that you may not even need to prescribe for a 72-hour period. It could be far less than that. It could be just a day, at the most maybe 2 days. Would the prescriber then have to go through this if the quantity prescribed is for less than 72 hours? Through you, Madam Speaker.
Representative Ritter.
Through Madam Speaker, no, they would not under this bill. Through you.
Representative Srinivasan.
Through you, Madam Speaker, is it the decision by the prescriber that if this patient comes repeatedly, frequently, but each time the need is relatively short, and it is multiple times that the patient comes, but the need is once again less than a 72-hour period, does it anywhere say in the language in this bill that then the provider will need to look into the program? Through you, Madam Speaker.
Representative Ritter.
Madam Speaker, no. And so if someone was trying to game the system, hopefully the physician at that point who was prescribing it would be hip to the game being played to them. You know what I mean? I mean, you're coming in every day looking for 48 hours here, 48 hours there. I think they would know them. And that's one of the things we heard a lot about, too, is sort of the form shopping to get someone else to prescribe. And I think if we can keep it under 72 hours, there's less concern of abuse, through you, Madam Speaker, than when people are getting weeks-long or month-long prescriptions.
Representative Srinivasan.
Thank you, Madam Speaker. I definitely agree, that when the prescription pattern is there and coming on a repeated basis, for a 48-hour kind of a prescription, but does not happen just once, but happens on a repetitive basis, the signals should go up, the alerts should go up, and regardless whether you need to check or you do not need to check, I would assume that a provider would check to make sure that the doctor shopping or the healthcare shopping does not happen. Through you, Madam Speaker, this 90-day checking into this program, would that apply only if you're prescribing a narcotic, or would it apply that any time you're prescribing a medication, the patient's profile would have to be checked into? And the reason I ask that, Madam Speaker, is you do not know what has happened to the patient in the interim period. You're seeing the patient every 3 months, every 6 months on a routine follow-up. And our goal here, on the one hand, is not to overprescribe. And on the other hand, is to also pick up patterns that patient may have, for which you may not be directly responsible. You may not be the provider of those prescriptions. So I just want to be clear that as you see these patients once in 3 months and 6 months, are we also saying in this language of the bill that the program, the drug monitoring program, needs to be looked into? Through you, Madam Speaker.
Representative Ritter.
Through Madam Speaker, it's only when they're prescribing a controlled substance, which is going to be higher level as DEA classified type drugs and substances. It's not going to be anti-inflammatory or something like that for you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, we just heard about the extra time and the inconvenience it is to the healthcare provider in terms of looking into the system. Through you, Madam Speaker, does it have to be the physician, the APRN, or the PA who alone, he or she alone, can look into the drug monitoring system, or are we allowing other people in an office setting, hospital setting, that can look into the system as well on behalf of the healthcare provider? Through you, Madam Speaker.
Representative Ritter.
Madam Speaker, good ranking member hit it on the head. That's exactly right. There can be a designated agent who can look for you as well. And, I don't work in a medical office. The person to my right does. And I might assume if it's like other paperwork and other things you might do, you might come up with a system where you have a designated person who does a lot of the checking. That way, you're right. If you're seeing patients and you're the physician and you say it might be better if someone who works with me in collaboration who's licensed under this bill to do it, they may do the checks at the end of the day or something like that through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, that person, that designee, who will now, he or she, will be looking into the system and obviously reporting back to the healthcare provider about the use or the abuse of opioids. Are there any requirements in terms of licensing, in terms of medical background of that person? Through you, Madam Speaker.
Representative Ritter.
Through you, Madam Speaker, the bill refers to them, they have to be licensed healthcare professionals. Through you.
Representative Srinivasan.
Through you, Madam Speaker, for my clarification, who are these licensed healthcare professionals? Through you, Madam Speaker.
Representative Ritter.
Through you, Madam Speaker, it would cover nurses, not just APRNs, licensed nurses, things like that. I unfortunately can't give you the full rundown of who it is, but it would be more than obviously doctors in the office. Through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, so a person who is who has a license in the state of Connecticut and is an employee of the facility, whether it be a private office or a healthcare system, as long as he or she has a license, and which could be an RN, it could be an LPN, it could be other providers. They would be the ones who would be checking the system. Through you, Madam Speaker.
Representative Ritter.
That's right. Through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker. So a receptionist who is very comfortable, who's been working in that setting, let's say for the last 20 years, 30 years, knows everything in and out, would that person help the system, help the provider by being allowed to look into the system on behalf of the provider? Through you, Madam Speaker.
Representative Ritter.
Through Madam Speaker, unfortunately, no, because unless they're a licensed healthcare professional, I'm assuming They're not in that example. So they unfortunately could not log into the system and make those checks. Through you, Madam Speaker.
Representative Srinivasan.
Thank you, Madam Speaker, for those clarifications, because it is important when we request healthcare providers, healthcare systems, that this is what we need to be doing moving forward. Hopefully this legislation becomes law of the land pretty soon. But when it does, so that people know what their responsibilities are and who cannot look into the system on behalf of the provider. Through you, Madam Speaker, on the healthcare provider, before we go to the other sections of the bill, as far as the educational programs, whether it be the physician, whether it be APRNs, through you, Madam Speaker, we are requiring them to be trained, to have 1 hour of training. Through you, Madam Speaker, will that be decided by us here, or will it be the societies that come out with these programs incorporate them in what they already do as far as the training for physicians or APRNs are concerned. Through you, Madam Speaker.
Representative Ritter.
To you, Madam Speaker. Exactly. So they have to, the way it works now, the CLE is 50 contact hours within 24 months. And one of the requirements would be prescribing controlled substance and pain management training. And so we're not adding to their CLE. We're not telling them exactly what they have to do. They can pick from a menu of options and get their training to equal their CLE hours through you, Madam Speaker. And just, I guess, as it was explained to me by most physicians who are comfortable with the position is, some of the stuff is very redundant. They get a lot of the stuff over and over. And so they kind of know what they need to do. Lawyers have to have training, I think, in my world. And I know some things I haven't done in a few years I'd like to catch up on. You kind of pick your CLEs accordingly through you, Madam Speaker. But no mandate as to what you have to go to.
Representative Srinivasan.
So through you, Madam Speaker, the number of the hours for CME credits at the end of 2 years, which is the 50 hours for the physicians, that doesn't change. It remains the same. But we are mandating, not requesting, but we are mandating that within that 50-hour period, 1 hour be spent in terms of education on this subject matter. Through you, Madam Speaker.
Representative Ritter.
That's correct. 1 contact hour through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, are we requiring and mandating that 1 contact hour be done every 2 years, or are, as long as they have done it once and they feel comfortable that they have the knowledge, that they do not have to repeat it and can use that extra hour for some other CME credits? Through you, Madam Speaker, past the first time around. Through you, Madam Speaker.
Representative Ritter.
Through you, Madam Speaker, as they go for renewal, I think it needs to be not less than once every 6 years, how the bill reads. There's a little more flexibility for them there going forward. Through you, Madam Speaker.
Representative Srinivasan.
Thank you, Madam Speaker, and I want to thank the good chair for that answer, because that's what we had done in the last session, where we had said that certain subject matters that the societies feel that adequate training or adequate updates have been given to the providers. They do not need to be repeated every 2 years just because it has to be repeated. It will be repeated if the need is there, so that if that time can be used very effectively for other CME credits. Through you, Madam Speaker, moving to the section on pharmacists. Through you, Madam Speaker, the allowing pharmacists to prescribe Narcan is a step in a very, very positive direction. And as a good Representative Conroy said, if you do not need the Narcan, and you happen to inject that into yourself, whatever be the reason you chose to do that, no harm can be done, because it is just going to be passed out through your system. But through you, Madam Speaker, the pharmacist who now is capable of prescribing the Narcan, obviously without the prescription from a healthcare provider, could the good chairman elaborate on the training and the certification that the pharmacist will need under the supervision of Department of Consumer Protection, so that he or she can prescribe the Narcan? Through you, Madam Speaker.
Representative Ritter.
Thank you, Madam Speaker. Looking around lines 248 to 250, it talks about the training by the Commissioner of Consumer Protection. Then also later we let them adopt regulations. I have to wonder if that might be part of the reg review process, exactly what that training would entail. Through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, the prescription of Narcan by a pharmacist, which is a step in the right direction. But if the pharmacist does not prescribe the Narcan, and unfortunately, we have a very negative outcome. Through you, Madam Speaker, is that pharmacist or the pharmacy liable in any way? Through you, Madam Speaker.
Representative Ritter.
Through you, Madam Speaker, it's funny, lines 251 to 253 talk about if you prescribe in compliance with the bill, you have not violated the standard of care for a pharmacist. The inability to prescribe is not touched in the statute. Right. I can't tell you what a trial lawyer might do, through Madam Speaker, but not in this bill. I see no issues. Through you.
Representative Srinivasan.
Through you, Madam Speaker, so a pharmacist prescribes, the Narcan is never used. That's wonderful, which is what we hope will happen, that you have the medication to be used if needed, and the need does not arise, which is the best case scenario. But in the opposite scenario, in the worst case scenario, the pharmacist does not prescribe. The unfortunate happens, and we have very negative outcomes. As I understand it, and I want for my own clarification for all of us here, that pharmacist, as we speak right now, if this legislation moves forward, is not liable in any way. Through you, Madam Speaker.
Representative Ritter.
Madam Speaker, they're not subject to any criminal penalties that I can see here or civil penalties. Liability, I wouldn't want to guess on that. That might be a factual issue for a trier of fact, but from a criminal or civil perspective in the four corners of this bill, no, Madam Speaker, there's no penalty there. Through you.
Representative Srinivasan.
Through you, Madam Speaker, since I'm glad there's no criminal liability, but I'm concerned about other liabilities, and here I'm going to bank on the good expertise of our chairman in his legal profession as to what could be the possibility, because it is important. Here we are giving them the option of prescribing. And if they do not prescribe, it is concerning at that point to make sure that we hold our pharmacists harmless. Through you, Madam Speaker.
Representative Ritter.
Thank you, Madam Speaker. I certainly don't want to highlight this point and have pharmacists in fear here of any liability. There's nothing in this statute which says it. The options for them to prescribe, and I think, again, it's the same for doctors as it is now. So I think they're going to be in the same boat as everybody else, who can prescribe this Narcan going forward. And I don't want to come up with or scare anybody with wild theories of liability. I think they've done a good job of not criminalizing the conduct or putting any civil penalties in. Through you, Madam Speaker.
Representative Srinivasan.
Through you, Madam Speaker, my intent is definitely not to scare the pharmacists. That's the last thing on my mind, because we definitely want this bill to move forward. No question about that at all. But I just want to make sure that we flush out and hold the pharmacists, hold them harmless. And in that discussion, Madam Speaker, the reason the situation for a pharmacist is a little different than the situation for a healthcare provider is the patient comes to the healthcare provider, and at that point in time, the provider may not, depending on what the situation is, prescribe the Narcan as needed. But in the situation for a pharmacist, and I'm sure all of us, unfortunately, have had this experience with friends, family, and others, that it is an emergency. They are, a group of people having a great time, and unfortunately, sometimes that fun turns south, heads in the wrong direction. And somebody has the presence of mind. Somebody in that group of friends, family, has the presence of mind. My God, things are happening here which should not be happening, and I don't see any Narcan around. And let me go and get a Narcan from the closest pharmacist, just to be sure that if something were to go wrong, we have the backup plan. We have, plan B in the event something were to go wrong. And that is why we put the pharmacist in a slightly different situation, in a position. Because here you have somebody coming running in and saying, I need Narcan, and the pharmacist now can prescribe. But also if the pharmacist, for whatever be the reason, does not dispense the Narcan, my concern is that pharmacist should be held harmless. Madam Speaker, my last questions about the pharmacists is their reporting or their getting on the PNP system. I just want to clarify as to from real time, which was the original intent, which is what we hoped we could accomplish. But obviously, we know the budgetary restrictions. We know where we are from a fiscal point of view. So I understand from real time, we have switched it now to going back to a week. So I just need some clarification on that. So the pharmacists now will go into the PNP at the time that the medication is dispensed, not at real time, but within a week's time. Through you, Madam Speaker.
Representative Ritter.
Thank you, Madam Speaker. Through you. That's correct. They'll do, and that's what they do now. Through you, Madam Speaker. It's the current process.
Representative Srinivasan.
And through you, Madam Speaker, that record keeping is all done electronically. Through you, Madam Speaker.
Representative Ritter.
That is correct. Through you, Madam Speaker.
Representative Srinivasan.
Thank you, Madam Speaker. And my final wrap-up on this subject matter from my side is these are recommendations we are making. Recommendations we are making to the healthcare providers in terms of going to the PNP, going back to the PNP when they do the 90-day prescriptions and their CME credits. We are also recommending that pharmacists go on and are capable of prescribing Narcan. Through you, Madam Speaker, all of these are only recommendations that we are discussing today, Madam Speaker, or are there any mandates here? Through you, Madam Speaker.
Representative Ritter.
Madam Speaker, I may have missed that one, and I apologize for that. I mean, some of the stuff is mandated in the bill. So the PMP system and things like that, we're not making that recommendation. We are requiring that through you, Madam Speaker. But maybe I missed the point of that question through. I apologize.
Representative Srinivasan.
Through you, Madam Speaker, I think I did not phrase that question correctly, and I apologize for that, and I will rephrase that. We are requiring, as opposed to recommendations, which is a better choice of word, we are requiring a long list of things that we need to be done by the healthcare providers in terms of going to the system, getting their CME credits, and also from the pharmacist's point of view. We're requiring them to do all of that. Are we requiring them to do all of that in good faith? Or are we saying that if any of this is not done, there will be consequences? Through you, Madam Speaker.
Representative Ritter.
Thank you, Madam Speaker. This really is a good faith bill. I think that's a good answer, and I hope that answers better to the question. We're looking to work with people here. I think that's always been the intent, and I think that's part of the reason it's been well received by a lot of the medical community that we've heard from in the Public Health Committee through you.
Representative Srinivasan.
Thank you, Madam Speaker. And as I said earlier on, this is a step very much in the right direction. Given the environment we are in, we did not accomplish all that we wanted in this bill. And I definitely understand that. Real time is critical because in trying to stop that shopping, it is important that we don't miss that window of 72 hours, that window of 90 days, when a person knows how to go around the system. And these people, Madam Speaker, are very, very good at that. They're very crafty, and they will come with a line that anybody and everybody is gullible to, and will go ahead and prescribe those medications, which obviously is not the right thing to do, but that's a storyline that you're given, and you fall for the storyline. You're going to the electronic record system. That is the good way to make sure that you do not fall for this. So although I would have preferred, Madam Speaker, for this whole system to be real time, because it would be far more effective, I'm extremely satisfied that at least we are requiring our healthcare providers, our pharmacists, to keep a tab on this epidemic, this unfortunate epidemic that we are faced with. And hopefully, as we move forward in the years to come, we'll tweak it so that it becomes real time. Thank you, Madam Speaker, and I want to thank the good chair for his answers, and I hope that my colleagues both sides of the aisle will be able to support this bill as amended. Thank you, Madam Speaker.
Thank you, sir. Will you remark?